Abruptio placenta. It is the premature separation of the placenta from the uterine wall. Risk factors: decreased blood flow to the placenta, multi-fetal pregnancy, abdominal trauma, pregnancy-induced hypertension because it causes vasoconstriction that results to a decrease in the blood supply. Types: apparent or revealed. There is bleeding from the site of placental separation and it drains through the cervix. Next is concealed. There is no evidence of vaginal bleeding because it remains within the uterus and typically forms a clot retroplacentally. Key manifestations: acute abdominal pain with dark red vaginal bleeding, either concealed or apparent. So if you notice, in placenta previa, it is painless and with bright red vaginal bleeding because it is a low-lying implantation. While here in abruptio placenta, it is painful and with dark vaginal bleeding since there is a premature separation of the placenta to the uterus. So don't be confused, okay? Next we have rigid abdomen. Lastly is an ultrasound result that will confirm the diagnosis and will show the current location of the placenta. Clot or hematoma may also be apparent. Management: avoid pelvic or vaginal examination. Position the patient in a left lateral recumbent position to relieve the pressure in the vena cava from the enlarged uterus. Cesarean delivery, blood transfusion, and watch out for its common complication like disseminated intravascular coagulation and fetal distress. Placenta previa. The placenta is implanted in the lower segment of the uterus. Risk factors: advanced maternal age, multiple pregnancies, and the presence of scar or tumor in the uterus. Types: marginal. The edge of the placenta touches the cervix. Partialis. The placenta partially covered the cervix. Totalis. The placenta completely covered the cervix. Key manifestations: painless, bright red vaginal bleeding. The ultrasound will show an implantation of the placenta in the lower uterine segment. Management: if less than 34 weeks, hospitalization and bed rest to avoid preterm labor. NSD or CS depending on the placental placement and maternal and fetal stability. Don't perform vaginal or rectal examination unless equipment is available for vaginal or cesarean delivery. Watch out for signs and symptoms of shock, fetal distress, and infection. Patients with placenta previa are at higher risk for infection. Blood transfusion if necessary. Pregnancy-induced hypertension. It is characterized by hypertension, proteinuria, and edema. Risk factors: 18 years old and below or greater than 30 years of age. Obesity, multi-fetal pregnancy, and present conditions like hypertension, renal disease, and diabetes mellitus. Types: first, we have gestational hypertension. It is a blood pressure of 140 over 90 millimeters of mercury. Next is mild eclampsia. It is the blood pressure of 140 over 90 millimeters of mercury, proteinuria of +1 to +2, weight gain of more than 2 pounds per week in the second trimester and 1 pound per week in the third trimester. Mild edema in the upper extremities or face. Next, we have severe preeclampsia. It is a blood pressure of 160 over 110 millimeters of mercury, proteinuria of +3 to +4, generalized edema, and in this type, there is a potent vasoconstriction that results to a decrease in blood supply to vital organs like kidneys, liver, and brain. A decrease in blood supply to the kidneys will result to oliguria, while a decrease in blood supply to the liver will result to what we call HELP syndrome, that stands for hemolysis, elevated liver enzymes, and low platelet count, which will put the patient at risk for bleeding. The patient will also experience epigastric pain. A decreased blood supply to the brain will cause frontal headaches, blurred vision, irritability, and hyperreflexia. Lastly is the eclampsia. It is a blood pressure higher than 160 over 100 millimeters of mercury in the presence of tonic-clonic seizure. Blood chemistry result will show increased BUN, creatinine, uric acid, and liver function studies like SGPT and SGOT. Management: high protein diet and low sodium diet. Maintain seizure precautions. Antihypertensive medication like hydralazine or diazoxide. Betamethasone is administered to accelerate fetal lung maturation. Magnesium sulfate is also administered to prevent seizure. Watch out for its toxicity like decreased respiratory rate, urine output, and deep tendon reflex. Our antidote is calcium gluconate.
Thank you for listening. I hope you learn and understand something. If you want more videos, don't forget to subscribe. See you on the next video.